Dr.Garima Asati. Welcome you all in my YouTube channel. Friends, today I am going to explain you about the topic scabies in English on the demand of few of my non-Hindi patients. So let's talk about scabies. It is also known as 7-year itch. It is a contagious skin disease and children are more affected, females are more affected, and nowadays 1.5% population suffers from it. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, because in the last I am going to explain you about some of the homeopathic medicines which can be helpful in curing this scabies. Now let's talk about the sign and symptoms of this scabies. So the incubation period is 2 to 6 weeks after infection symptoms appear. And the symptoms are intense itching which is intolerable and more at night or worse at night. Then linear tracts or S-shaped tracts are formed under the skin, and along the line of the tract some pimples or some eruptions may occur. Inside that tract, the mite, that is Sarcoptes scabies, remains and lies within that tract. The eruptions are linear or S-shaped too. The eruptions are just like as if a mosquito has bitten or insect has bitten. And burrows are made by these mites, and the region which are involved are the finger webs, feet, buttock region, or even the genitals, vulvar region or scrotal region, or even the trunk area. Blisters or pustules may occur at the region of the palm and the sole's feet, and immunosuppressed individuals like suffering from HIV, cancer, AIDS, those people are at more risk for this scabies. And crust formation may take place after the scab formation. Symptoms may persist from 1 day to several weeks, even to years too. Now let's talk about the causes of this scabies. So Sarcoptes scabies is the mite which causes this scabies. When it moves within the burrows, it causes more itching. And through physical contact, sexual contact or touch, it may spread from one person to another. So it is an easily transmitted disease from person to person. And sharing of cloths, towels, bedding, it can also lead to this scabies. It occurs more in the humid weather or in the rainy season. Now let's talk about the diagnosis of this scabies. So physical symptoms or physical examination is more than sufficient. Now let's talk about the prevention. So the clothing or bedding should be washed in hot water of the infected person. It should not be shared with a non-infected person. So it can prevent the non-infected person to get infected. Now let's talk about the management part of this. So antihistaminic drugs or anti-inflammatory drugs can be given. Now let's talk about the homeopathic management. The cause of scabies via homeopathy and one of the cured case of this scabies via homeopathy and some of the homeopathic medicines which can be helpful in curing this scabies. So the cause is separation conflict. When a person gets separated or having a fear of getting separated from any near or dear one, it can lead to this scabies. Now friends, I would like to tell you one of the cured case of mine of this scabies via homeopathy. A boy, 12-year-old, suffering from this scabies since last 1 week and having too severe itching. There is dryness of the skin. Sometimes it may ooze too. And the person, that boy, that patient is too much loquacious, very extrovert, communicative, expansive. 1 minute sentence takes 10 minutes to tell by him. Very communicative, expansive. And the reason why he got scabies was ailment from embarrassment. That the rubric taken in this case. But why so? A school friend has cheated him, and because of that, he got punishment in the school by the teacher. And the reaction was, he gets embarrassed because of that punishment. So the rubric taken was ailment from embarrassment, and the sulfur 200 was given, which cured him completely within a period of 10 days. Now let's talk about some of the homeopathic medicines which can be helpful in curing this scabies. So the first medicine is sepia. So there is dry scabies. It can never be moist in sepia. There is too severe itching which can never get ameliorated from scratching. And there is hard, dry, rough skin which gets aggravated from cold weather. When we talk about the mental symptoms of sepia, so the patient is indifferent to loved ones, close ones, indifferent to work, any kind of occupation, but tries to be busy and industrious. Contradiction, intolerance is there. So if these symptoms correspond, sepia can be helpful in curing this scabies. Next medicine is silicea. So there is dry scabies. The skin is very delicate and sensitive. Fistulous tracts can be seen very easily, and the itching is more at daytime. And cold aggravation is there. There is uncovering aggravation. Patient wants to just cover only. And when we talk about the mental symptoms, so the patient is very obstinate, headstrong, having fixed ideas, desire to be magnetized, and there is timidity in appearing in public. So if these symptoms correspond, silicea can be helpful in curing this scabies. That's all about this topic. We'll meet soon with a new topic, new subject. It's my humble request to you all, kindly don't take any medicine without consulting doctor. So kindly consult the doctor before taking any medicine. The clinic address of mine and the contact number is given in the description link. Stay connected to stay healthy. Thank you.